What is a normal heart rate for a school-age child, 6 to 12 years of age, in beats per minute, BPM? A. 100 to 140 BPM. B. 50 to 70 BPM. C. 70 to 120 BPM. D. 120 to 160 BPM. The answer is C. 70 to 120 BPM. Normal heart rate for a child aged 6 to 12 is 70 to 120 BPM. This is moderately higher than normal heart rate for an adult, which is 60 to 100 BPM. What is the correct way to determine proper blood pressure cuff size? A. The inflatable bladder should cover approximately 50% of the circumference of the forearm while its width should cover approximately 20%. B. The inflatable bladder should cover approximately 80% of the circumference of the forearm while its width should cover approximately 40%. C. The inflatable bladder should cover approximately 40% of the circumference of the forearm while its width should cover approximately 80%. D. The vinyl covering should be able to wrap at least twice around the forearm. The answer is B. The inflatable bladder should cover approximately 80% of the circumference of the forearm while its width should cover approximately 40%. Proper cuff size is very important for accurate blood pressure assessment. The correct way to determine proper blood pressure cuff size is to wrap the cuff around the arm, then note the area covered by the inflatable bladder. The inflatable bladder should cover approximately 80% of the circumference of the forearm while its width should cover approximately 40%. A stethoscope has two components to the chest piece. These are called the dash and the dash. A. Cone. Diaphragm. B. Bell. Diaphragm. C. Bell. Disc. D. Cone. Disc. The answer is B. Bell. Diaphragm. The chest piece of the stethoscope is made up of two components designed for auscultation, the bell and the diaphragm. The bell is dome-shaped and used for auscultation of low-pitched sounds, while the diaphragm is used to auscultate high-pitched sounds. A nurse takes a patient's blood pressure and records it at 146/92 millimeters of mercury. This is the patient's first visit to the clinic and they have no past medical records available. Would this patient be diagnosed with hypertension? A. Yes, this is stage I hypertension. B. No, there is not enough information. C. Yes, this is malignant hypertension. D. No, this is within the normal range. The answer is B. No, there is not enough information. A patient with a one-time high blood pressure reading cannot be diagnosed as hypertensive. A diagnosis of hypertension requires at least 3 measurements of blood pressure over 140/90 millimeters of mercury on at least 2 separate visits to healthcare provider. A patient with a blood pressure reading of 168/102 millimeters of mercury on 3 or more occasions would be diagnosed with what stage of hypertension? A. Stage 3 hypertension. B. Stage I hypertension. C. Stage 2 hypertension. D. Pre-hypertension. The answer is C. Stage 2 hypertension. Stage 2 hypertension is defined as a blood pressure equal to or greater than 160 mm of mercury systolic over 100 mm of mercury diastolic, taken at 3 different times on at least 2 separate occasions. Stage I hypertension is systolic blood pressure of 140 to 160 mm of mercury or diastolic blood pressure of 90 to 100 mm of mercury, while prehypertension is defined as a systolic blood pressure of 120 to 140 mm of mercury or diastolic blood pressure of 80 to 90 mm of mercury.